Well, I'll tell you a little bit about myself first. I studied at the University of Pretoria, undergraduate and postgraduate. Then after that, I went to the United States, where I did infectious diseases in Barnes and Jewish Hospital and Washington University. And then when I returned to South Africa, I first worked in the military hospital. Then I worked at Tygerberg Hospital as a consultant in infectious diseases and also taught infectious diseases at the University of Stellenbosch. From there I went into private practice in Stellenbosch, and from Stellenbosch I then returned to Pretoria, which is actually my stomping ground, and then started off in infectious diseases practice. So what does it mean to be an infectious diseases physician? It means that one has an insight in the pathophysiology and the way that so-called germs in general work, but in my terminology that would be viruses, bacteria, higher order bacteria, fungi, and other parasitic infections that can be caught by patients. Then after, it also means that when there is something really dangerous that comes around, such as Congo fever or Ebola or one of these major diseases, that through the years I actually treated that. And I also was responsible for treating the SARS patient who was in this hospital many years ago when SARS was a problem. So I've been in infectious diseases now for the last 37 years and uninterruptedly. And infectious diseases in effect means that I have a very good knowledge and feel for how to use antibiotics and how to counteract and to protect against infections of all natures. The difference between, because I think we're speaking about mainly the flu virus, which of the respiratory viruses is considered to be the most dangerous. The difference between the flu virus and the coronavirus is that the R value for flu is 1. That means that each person with a flu infection infects another person. But with coronavirus it is different, because one person infects 2 to 3 people. Therefore the infectivity is much higher, but the fatality rates are about the same, which is about 2%. So for the general person, this virus does not really have a threat. Obviously, there are people who die of this virus who do not know that they have problems with their immunity or underlying disease, but it is mainly those with underlying disease and with problems with immunity who will succumb to the disease. The reason that this really is a problem is because the rate at which the infection spreads is so enormously high that eventually the medical systems cannot cope with the amount of patients who warrant ventilation. The reason I felt that it would be a very good product is because in general it is known that H2O2 or peroxide is a very volatile molecule that only has a short half-life. In the bottles that we use for disinfection in the practice, the H2O2 actually is we need to throw away the rest of the fluid after 3 days of use, so that the fluid that is used as with a cloth on the surfaces is not acceptable after a day, so after 3 days. So the minute you put it onto a surface, the volatility causes it to evaporate rather fast, and for this reason the surface cleaning needs to be done on a regular basis. When you look at the nanoparticles that are in the HydroMists that you are suggesting as a solution to the problem, you look at something that has in the nanoparticles, the H2O2 is viable for up to 5 days, which makes it very different from the H2O2 that is applied to surfaces. And for that reason, I felt that with the concentrations that can be reached with the amount of nanoparticles that are on a surface and the size of a virus, that it should be superior to other surface cleaning elements. The only thing about it is that on surfaces where there is friction, the nanoparticles can be expected to rub off onto the surface that then is in contact with it. For example, where people touch or where people sit, and that one would just have to do disinfection of those specific areas for that reason. The COVID-19 is spread because when people cough or sneeze, there are secretions that land on people's hands. This is taken care of largely by masks. But when I was in St. Louis, an interesting study was done. They took a nurse and they took an infectious diseases physician who was supposed to know about transmission of infection, and also a guy who was on the infection control committee. And both of them had a cold. They injected them with a fluorescent substance, and then afterwards, at the end of the day, they did something that was not visible during the course of the day, and they had to look at where on the people's body there was fluorescent substance. And the fluorescent substance was everywhere from the tip of their scalps up to their knees. Wow. And to the tips of their hands.
Which means it spreads.
Which means that it is very difficult to keep it from spreading on surfaces rather extensively, in spite of hand hygiene that was practiced by these people. And the reason for this is that it also lands on clothes, and there is nothing that you can do to prevent you from touching your clothes, because you need to remove a pen, you need to put things into your pockets, you take things out of your pockets. So yes, it means that it does spread on surfaces, and therefore surface decontamination is hugely important, because if the viruses are on surfaces where some of these fomites have landed and you touch it, it is on your hands immediately. So disinfection of the surface then reduces infection of the hands, which again reduces infection of the face, because the true areas that you want to prevent the virus from getting into are the mucous membranes. That would be the cornea, the nose and the mouth, and for that reason one would want to minimize that transmission. The reason one would choose HydroMist is because of the theoretical advantage that one gets from the nanoparticles that are on all surfaces and that come into close contact with virus under all circumstances, whereas the other substances actually disappear and evaporate in a shorter period of time. Where the HydroMist has a life of up to 5 days, the other substances need to be replenished reasonably often.